Okay, my name is Emily Schoonover, and this is the head to toe assessment. I'm going to start by scanning the room. Okay. Okay. So we'll start the exam by looking at the skin of the face, the head, the neck, the anterior and posterior chest, and the abdomen. And we are looking for color, temperature, texture, moisture, edema. We're looking for any bruising, scars, nevi, any lesions or masses. And everything looks good. I don't see anything. His head is midline. It is normal size and symmetric. And then we will look at the hair. So we're looking at hair distribution, make sure there's no infestations, looking at the scalp and feeling the scalp, make sure that there's no depressions or masses or lesions in there, and everything looks good. Then we will move to the lymph nodes. We're going to palpate these. Let me know if you have any tenderness. All right. This is preauricular, postauricular, tonsillar, submandibular, submental, occipital, anterior cervical, posterior cervical, and supraclavicular. Oh, I don't know why I couldn't say that. Okay. Do you have any tenderness there?
No.
No. Okay, good. All right, so now then we will move on to the ears, and we will assess the ears and make sure that there's no tenderness on or masses on the tragus and the pinna. Do you have any tenderness there?
No.
Okay. So I'm going to look in the ears and look at the auditory canal, and look at the tympanic membrane. The tympanic membrane is pearly and gray. There's no redness in the auditory canal. I'm going to look at this side also. Okay. All right, tympanic membrane is pearly gray and no redness in the ear canal. All right. Now we will assess cranial nerve number 8, which is hearing. So I'm going to whisper a word on each side and then just repeat it back, okay?
Walter.
Okay.
Walter.
Okay. Good. All right, now we will perform the Weber test. So I'm just going to put this on your head. Just let me know if it's equal.
Yes.
Okay, good. All right, and then let me know when you can't hear this anymore.
Gone.
Okay. Again, can't hear.
Gone.
Okay, good. Okay, let me know when you can't hear.
Gone.
Okay, and you can't hear.
Gone.
Okay, so that was the Rhine test, and that is assessing for that air conduction is greater than bone conduction, and that is good. Okay, so now we are going to assess eyes. I'm going to start by looking in the eyes. I'm going to look at the pupils. And this is cranial nerve number 3, making sure that they are equal, round, and reactive, and they are good. And then we will look at the red reflex. Okay, I'm just going to look and see the red reflex and the optic disc. Same on this side, red reflex and optic disc, and the disc is easily seen and has clear margins. Now we will assess vision. Cranial nerve number 2. We're going to assess direct vision and peripheral vision. So I'm going to get you to cover your one eye. Okay, and then tell me the smallest one you can read.
DHJBS.
Okay, so that's 20/40 in the right eye, and the same thing with the other eye.
DHJBS.
Okay, good. So 20/40 in the left eye, and he does use corrective lenses. We are going to assess for peripheral vision now. So same thing, you can cover one eye. Okay, and then just let me know when you can look at me and let me know when you can see my finger move.
Yep. Yep.
Okay, good. And the other side?
Yep. Yep. Yep.
Okay, good. All right, so that is to assess peripheral vision. All right, now we're gonna assess accommodation. So I'm gonna get you to look at something on the wall back there. Okay, and then look at my finger. Okay, good. He has good accommodation. His pupils dilated when he moved to the finger. All right, now we're gonna assess convergence. All right, so I'm gonna get you to watch my finger. In. Okay, and his pupils dilated, so he has convergence. So his pupils are equal, round, reactive to light, and they are accommodating and have convergence. We're gonna assess the fields of conjugation. I'm sorry. I'm gonna get you to follow my finger, okay? Okay. And this assesses cranial nerves 3, 4, and 6. Okay. Look in your eyes. Yeah, okay. Okay. Oh. Conjunctiva is clear. There's no drainage. There's no lesions. We're looking at the eyebrows and the eyelashes and the palpebral fissures, and they are symmetric and appropriate. Okay. Nose is midline and straight. We're going to assess patency if you can include one side. Okay, good. And the other side, good. And then it's patent. And now we're going to assess cranial nerve number 1. I want you to close your eyes. And then just tell me what you smell.
Vanilla.
Good, okay. Okay, now I'm going to assess the sinuses. So I'm just going to feel on the frontal sinus. Let me know if you have any tenderness. Any tenderness?
Nope.
Okay, maxillary sinuses, any tenderness?
Nope.
Okay, now I'm just going to assess the mouth. Okay, I'm going to get you to open and look at the salivary glands, the tongue, the buccal mucosa, posterior pharynx. Lift up your tongue. We're looking at the floor of the mouth. We are looking at the gums and the teeth. The teeth are aligned. We're looking for any lesions, discoloration. Everything looks good. Tonsils are 2+. And then let me get you to open your mouth one more time and say ah. Okay, the uvula is midline and the soft palate rises symmetrically. That's cranial nerve number 9 and 10 are intact. And then stick out your tongue. Okay, and side to side. All right, that's cranial nerve 12. And there's no fasciculations, and the tongue is midline, so it is intact. Okay, now I'm going to assess your trachea. And the trachea is midline. Okay, and then put your head down and tilt towards me. Swallow. Okay, and then same on this side. Put your head down and then swallow. Okay, good. Assessing the thyroid, and do you have any pain doing that?
No.
I didn't feel any nodules or masses there. Now I'm going to assess for the carotid artery. I'm just going to palpate on each side. And then I can feel it. It is regular. Now I'm going to listen for any bruise. Right. With my bell. And there's no bruise. Okay. Now we will move on to the chest. So I'm going to get you to turn towards me this way, and I'm going to go behind you. All right. So we'll begin looking at the chest, making sure that there's no obvious signs of respiratory distress, no tachypnea, there's no cyanosis, no tripod position. There is no accessory muscle use, and everything looks good. There's no obvious deformities or anything like that. Just need you to take a deep breath. Okay, chest rises and falls, and it's symmetric. So now we will listen. Okay. Starting above the scapula. Okay. In each area. And then we'll get the right middle lobe on underneath the arm on the right side. Okay, now I'm gonna assess for tactile preferences. I'm just gonna just say 99, whenever you feel my hands, okay? Now you can say it out loud.
99. 99. 99.
All right, good. So, there's no evidence of consolidation. So I'm gonna listen now. Whenever you hear my stethoscope, we're gonna do whisper pictorially. Just say, whisper the word 99 this time. Okay, good. Now we're gonna do bronchophony. Just say the word 99.
99. 99. 99. 99. 99. 99.
Okay, and then egophony. So just say the letter E when you know for myself.
E.
Okay.
E. 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 E.
Okay, fantastic. Okay, and now I'm just gonna percuss. Okay, and there's just resonance heard there. Okay, you should turn this way, and we're gonna assess your chest, the front of your chest now, and your respiratory system. Okay, so we're looking, make sure everything is, once again, there's no signs of respiratory distress. We are gonna palpate and just see, take a deep breath. If everything is symmetrical, good. Everything is symmetrical, there's no signs of deformities there. Okay, I'm gonna put my hands on your chest again and then get you to say 99 out loud, okay?
99.
Okay.
99. 99.
Okay, good. No signs of consolidation. And now I'm gonna listen to the breath sounds on the front. Okay, good. Okay, and now we're going to move on to the cardiac portion. So I'm going to begin by auscultating over the different points, and I will say them. Aortic is second intercostal space, right sternal border. Pulmonic is second intercostal space, left sternal border. Herb's point is third intercostal space, left sternal border. Tricuspid is fourth intercostal space, left sternal border. And then mitral is fifth intercostal space, mid-clavicular line. I will switch then to the bell in my stethoscope and listen to each one also there. Aortic, pulmonic, Herb's point, tricuspid, mitral. Okay, good. Now I'm going to palpate for the PMI. Okay, which is here. And I'm going to auscultate with my diaphragm for a full minute. And the rate is regular and it is 75. Okay, good. Now I'm just going to get you to lay back. Now we will repeat the cardiac auscultation. Aortic with the diaphragm, pulmonic, Herb's point, tricuspid, and mitral. And then we'll switch to the bell then and do the same thing. Aortic, pulmonic, Herb's point, tricuspid, and mitral. And there's regular heart sounds, S1, S2, no extra gallops, murmurs, or anything like that. Okay, now we will palpate each point for any thrills. All right, aortic, pulmonic, Herb's point, tricuspid, and then mitral. And there's no thrills. I'm looking for any jugular vein distension while he is laying flat, really 30 to 45 degrees, but there is none. Then we'll move on to the abdomen. Okay, so I'm gonna pull up your shirt. Okay, just looking at the contour of the stomach, it is flat. There's no obvious deformities or masses. It is symmetric. And then we will start by listening. Okay, I'm gonna start with the right lower quadrant, and then the right upper quadrant, and then the left upper quadrant, and then the left lower quadrant. And we are going to listen to I'm turn this over. We're also going to listen for any bruits on the aorta, the renal arteries, the iliac arteries, and the femoral arteries. Okay, and there's no bruits present, so that's good. Okay, now I'm going to percuss. And then there was timpani sounding over each quadrant. And now I will palpate each quadrant. I'm going to put you on shoulder. Let me know if you have any tenderness. Okay, so no tenderness. And now we will do deep palpation. So I'm going to palpate for the liver on this right side. And I do not feel it. And then on the left side, we will deep palpate for the spleen. I do not feel it. Okay, good. Bowel sounds were normal, active, and no problems there. Okay, I'm going to get you to sit up. And we're going to check for CVA tenderness. So I'm just going to hit your back. Just let me know if you have any tenderness, okay? Any tenderness?
Nope.
Nope. Okay, good. Okay, so now we will move on to the arms and your hands. First, we're just going to look at the overall color and temperature. He has good color. They're warm. There's no problems with turgor. It bounces back. Same thing with the legs, color, temperature, skin's intact. Okay, we're going to start with your fingers. We're going to look for capillary refill on each hand, and it is less than 3 seconds. Good. Okay, and now I'm going to palpate your radial pulses. Okay. All right, good. All right, 2+ on the radial pulses. Okay. Now we are going to do some range of motion with the hands. Okay, so put your hands out. Your fingers down is flexion, extension, hyperextension. Thumb across is thumb opposition. Your fingers out is abduction. And then fingers together is adduction. Good? Okay. And then your wrists, flexion, extension, hyperextension, radial deviation, ulnar deviation, rotation. Okay, good. Then your elbows, flexion, extension, and then hyperextension out. Good. All right. And your arms, your shoulders. Sorry. All right. You can push out. Okay, so that is abduction. Okay, and then push in is adduction. Good. All right, and that's 5 out of 5 for the shoulder strength. Also, I'm gonna go ahead and get you to squeeze my fingers. 5 out of 5 for strength on that. And then lift your arms up against mine. Okay, and then push down. All right, so elbow strength, 5 out of 5. Good. All right, and then for your shoulders also, we're gonna do circumduction. Okay, internal rotation, external rotation. Good. We did abduction and adduction already. Okay. Shoulders. I'm gonna get you to press up against my hands. Okay, 5 out of 5, and that assesses cranial nerve number 12. Okay, now I'm gonna look at your toes. All right, so we're checking capillary refill on each toe. Just by pressing, and it is less than 3 seconds. We're assessing the dorsalis pedis pulse on the top of the foot, and then the posterior tibial pulse on the inside of the ankle, and they are both 2+ also. So they are good. I'm going to assess your if you can sensation. You can close your eyes. Just let me know when you feel it.
Yep.
Okay. Legs and arms. Good. Okay. And then we're going to do some range of motion with your toes. Okay, so if you point your toes in, that's flexion, up, extension, all the way up, hyperextension. His ears. Okay. Toes apart is abduction. Toes in, adduction. Okay, good. All right, and then we're going to move on to the ankles. You can rotation. Up is dorsiflexion. You can point them towards you. And then down is plantar flexion. Okay, if you can point them in together, inversion. And then out is eversion. Okay, good. And then we did rotation. Okay. All right, hold on 1 second and we'll get you to stand up. Okay, so now we're gonna work on, let me get you to turn towards that so you can see a little bit better. Okay, we're gonna do knees. You can bring your knees up on one on each side, that's flexion, extension is out, and then hyperextension. Okay, all right, and then your hips, this is flexion, flexion, extension, hyperextension, hyperextension. Okay, and then abduction, and then abduction. Okay, and then adduction, you're going to go across that side. Okay, and adduction. Okay, good. Internal rotation, you know, put your knee across. I'm sorry. Okay. Same thing on each side. Okay. And then external rotation. External rotation. And then circumduction. You're just going to circle and circle. Okay, now I'm going to get you to bend over. I'm just going to look at your spine. So this is flexion of the lumbar spine also. And we are going to look at the spine, make sure it's midline. There's no signs of scoliosis, and you're good. So you can stand back up, and then it's extension. And then if you can lean back, that's it. Hyperextension. If you can lean to the side, that's lateral flexion. Lateral flexion. Okay, and then turn, rotation. Okay, good. All right, so now for your cervical spine, I need you to tilt your head towards your chest. That's flexion. Up is extension, and then back is hyperextension. Put your ear to your shoulder on each side, and that is lateral flexion, and then twist. And that is rotation. Okay, good, thank you. All right, now we are going to assess cerebral coordination. We're going to do finger opposition, so do this, okay? And then we're gonna do finger point, so, okay, good, and then same thing over here. Okay, good, and then hand flip-flop, okay, good. All right, now I'm gonna do your deep tendon reflexes, okay? So this is the brachioradialis, okay? And then this is the, is the bicep, okay? And then back here is the tricep, okay? And the same thing on this side, bless you. Brachioradialis, okay? And then bicep, okay? And then tricep, okay? Good. And now I'm going to do patellar. All right. Good. All right. And then Achilles. Right there. Achilles. And then, I'm sorry, that was back behind his ankle. And then Babinski. Sorry. On each side. Okay, and now we're going to do, I want you to close your eyes and put your hands out. This is stereognosis, and I'm just going to get you to identify whatever I put in your hand.
Coin.
Okay, good. All right, so that is intact. And then now I'm going to get you to close your eyes, and I'm going to draw something on your hand, and just tell me what it is.
8.
Good, okay. All right. Now I'm just going to get you to say it one more time. Sorry, I should have done that first. But all right, now I'm going to get you to close your eyes. This is a Romberg test, and he is stable with his eyes closed, standing up. So that is negative. All right, now I'm going to assess your gait. So if you can walk that way for me, and then walk back, put heel to toe. Good. Okay, and he is able to do that. All right, and then for the last thing, I'm going to get you to jump on 1 foot. All right, fantastic. That concludes our assessment.